Usually the biggest complication of a conference is saying my name, and you said it perfectly, so thanks a lot.
Talk to Tom.
Okay, perfect, perfect. Awesome, thanks for the big words here, forward. Awesome. Or does that work? I'll use this one. Yeah, okay. Fantastic, yeah, thanks. I wanted to talk about complication with photodynamic therapy. I started doing photodynamic therapy with Dr. Ross in 2001, and we had this awesome KTP laser that was pumped with a dye laser to get us to 630 nanometers. And we were doing very aggressive treatments, taking care of all types of skin cancer other than melanoma and Merkel cell, and treating them very aggressively. 24 hours of incubation and large volumes of 630 laser light dwelling times. We even did some nasopharyngeal carcinoma. And these all responded in some way. So I'm very used to early on using these high incubation times, aggressive treatments, and we'd see people that would have redness that would last for months, for weeks. And the way we would be able to tell if a patient was going to have a good response was the fluorescence of the protoporphyrin 9 with the black light after they had incubated for a time. And this is just a couple of examples of really focused application of the ALA to an area that had surrounding areas of actinic damage. And in these cases where skin preservation was key, we could put really focus our ALA treatments. And so I've been doing this for 24 years and have now used it really daily for a lot of my skin cancers, and especially my squamous cell in situs. A lot of times we'll get a large area that looks like it's going to be a very large defect and be able to treat it aggressively with the red light PDT. Long incubation times now I use about 3 hours. I no longer use the laser, I use the LED panel. But I'll also use the KTP green light, which also is a part of the Surette band, and even assist the delivery of the ALA with fractional CO2. And we end up taking patients that have apparently large defects and treat them and end up with very small Mohs defects that are much easier. So this is my complication. I say this because I've seen patients have a lot of complications. The PDT effect is what we call the look of a resurfacing patient, really, after PDT has been done aggressively. And I have done PDT under general anesthesia, having been in the Navy, treated various things, but I've never seen anybody have persistent erythema for months at a time. And this is a patient that had already 10 Mohs surgeries. She had 3 new biopsy-proven sites, so we treated them with PDT first to try and shrink some of the atypical squamous cell proliferation around the squamous cell in situ lesions on her nose, her sidewall, and her forehead. So here you can see the forehead lighting up. We've got the blue light. We have you can see a lot of the atypical squamous cell that is lighting up from the protoporphyrin 9. This is again 3 hours of incubation of ALA and then application of red light. Here, after the treatment, we noticed the skin was still fluorescing, and she had this response a week later, and then 2 weeks later is still having a significant response. Now, after 6 weeks, we're starting on the nose lesion first with, you can see the Mohs defect there, but she still has, it looks like in this photo, hyperpigmentation, but this is persistent erythema on her right forehead and cheeks. Then at 4 months, she still has erythema. And it was very concerning. It lasted all the way until 8 months. And this is my final photo. I'm sorry, you can't really see, but she has she looks like she's been resurfaced, essentially. She has no brown spots, or a lot of her wrinkles are improved. And this is what I've seen over and over again with PDT, especially aggressive PDT, is where patients can look pretty bad, but always end up with a smile if you give it enough time. And I love the comments made by some of the other speakers saying, just handhold, hang in there, don't do too much. I did a little bit of KTP, visible light laser to try and reduce some of the erythema, but it was a waiting. And again, this was 8 months later it took for this erythema to go away. It's the longest I've seen of thousands of cases that I've done with very aggressive PDT. And it was pretty concerning. The other thing here, as a part of a witness for the California board, that is a very, very important take-home message, is stay with your patient, build that rapport, and handhold them through it, even when you're not sure what's going to happen. Fortunately, actually, when I was with Tom in 2004, we had a patient that we did a PDT case on, and she looked great. Maybe 15 minutes of, I think it was blue light at the time, and then we sent her out. She took the ferry home back to Cape Cod, and came back a couple days later, literally looked like we had done 3 pass CO2 resurfacing. But again, a month and a half later, looked incredible. And I really like this case because it did scare me. I didn't know why the erythema was lasting so long. I tried all kinds of things. Was it allergy? What was going on? And it just took time, a little bit of visible light, anti-redness laser with the KTP. But I really encourage you all, again, to be careful. When you see a lot of redness, just go ahead and wait it out. They're gonna do well if you did the proper technique with PDT. Anyway, thank you very much.
Thanks, Nate.